people are not very happy when growing up and having belly pain. I've heard of stories where people have been vomiting, 10, 15 times a day on these medications. And it obviously, aside from being, medically concerning, it decreases quality of life.
This is All Things Fitness and Wellness, hosted by Chrissy Van. Together, we're uniting industry thought leaders and fitfluencers on the mission to inspire innovation and encourage people to live a life fit and well. Brought to you by Fitness World. Your fitness, your way. Visit fitnessworld.ca. Welcome to our first episode of Exercise Snacks Bite-Size Science. These new snack size episodes will be every other Monday, where we discuss the latest research in fitness and wellness straight from the scientists and researchers themselves. On today's show, we welcome Mohit Sodhi, a fourth-year medical student at the University of British Columbia, who was just named in Forbes' top 30 under 30 in healthcare. Sodhi recently faced global media attention for revealing the heightened risk of severe stomach issues with Ozempic and other similar weight loss drugs. We're going to be learning more about this study and what it means for those who are entertaining GLP-1 semaglutide as a weight loss tool. But before we get to it, be sure to hit like and subscribe. We have new podcast episodes every Wednesday featuring industry thought leaders. I'm your host, Chrissy Van, and this is ATFW. I know that there's so much talk in media right now about GLP-1, semaglutide. People know the names Wegovy, Ozempic. So explain to people, first of all, what they are and what was the intended use.
So GLP-1 agonists are a class of medication that were initially approved for diabetes management. So what GLP-1 does is that it stimulates glucose-dependent insulin release from the pancreas. So when glucose comes into the body, it stimulates insulin release from the pancreas to help lower the amount of glucose in the blood when someone takes that medication. Now, one of the side effects that was found in GLP-1 agonists is weight loss. With regards to that, the mechanism of action is that it delays gastric emptying. So it sends signals to the brain, making you feel fuller. So that's why you end up getting some of the side effects, but also get some of, like the negative side effects, but you also get some of the positive side effects in that you lose weight.
Well, and we saw the media storm that happened around that. And I know because of that, there were even some shortages when it came to getting the medication. People that needed it weren't able to procure it. So it has been a massive topic of discussion. But as much as a lot of people have celebrated the side effect of weight loss, there are other pieces to the story when it comes to its use. We know there can be other side effects. So before we dive into your particular piece of research, what were some of those notable concerns?
So with regards to some of the other side effects that people were having, they're usually found in the randomized control trials. A lot of people had nausea, vomiting. There was some incidents of pancreatitis, biliary disease, things like that. And then eventually, our research came along, and ours was the largest study to date to examine these side effects in a real life clinical setting as opposed to a randomized control trial. It's called a pharmacoepidemiologic study. And we actually found that there is an increased risk, in addition to some of those other side effects that I mentioned, of gastroparesis, or that stomach paralysis, as well as bowel obstruction.
So tell me how this research was conducted and who were the people that were involved in the trial in regards to, did they have particular ailments? Was this ruling out particular ailments from the get-go? What did this look like?
So we used a health claims database based out of the USA. It's a random sample of 16 million patients from across the country. We specifically had people, a part of our study, who were using the medication for weight loss. So diabetes in and of itself can actually increase the risk of some of the outcomes that we looked at. So the main outcomes that we looked at were bowel obstruction, gastroparesis, biliary disease, so things like gallstones, gallbladder infections, things like that, pancreatitis as well. And diabetes can actually, at baseline, increase the risk of those particular conditions. So what we want to do is kind of take diabetes out of the question and kind of only look at people who are using it specifically for weight loss. Plus, as you mentioned earlier, there's this huge craze for people using these medications for weight loss. So that's another reason why we kind of wanted to look at it.
So when you talk about the results, what was the prevalence of these issues that were coming up, and how does that translate? Because I think it highlights 40 million in the US in 2022. So this is widespread use of these medications. So how frequently were these occurrences? And because I know sometimes we hear things from a study and then you're like, do we need to actually be concerned about this, or is this a small percentile? But when we're talking about millions upon millions of people using it, would there be cause for this to be a strong consideration if you're going this route?
Yeah, so when you look at the actual incidence of these adverse events in and of themselves, they're actually not super common. So I'll give you an example. With semaglutide or medications like Ozempic and Wegovy, with use of those medications, there was about a 1% incidence of gastroparesis. So that's that stomach paralysis. Now, it doesn't seem like a whole lot, but when you, like you mentioned, when you have millions and millions of people taking these medications, that can surmount to tens of thousands or hundreds of thousands of people, right? So when you scale it on a larger population, that number actually can be quite significant. And these side effects, I mean, people are not very happy, when they're
Fair.
growing up and having belly pain. I've heard of stories where people have been vomiting 10, 15 times a day on these medications. And it obviously, aside from being medically concerning, it decreases quality of life.
Not just physically when you're dealing with something like that, but mentally, that would be really tough to get through. I know I don't know if you can kind of fact check this for me, but you kind of hear a lot of talk that if you start on these medications that you can't stop them. Is there truth to that? How does that work? Because I can't imagine if all of a sudden you're having these adverse side effects that it's something you'd necessarily want to continue onwards with.
Yeah, so that's a bit of a tricky question because it was relatively new when these medications were approved for weight loss. So it is, there's a lot of area on whether or not you can stop it or you can't stop it if you gain the weight back, if you lose muscle, all these sorts of things. People are doing a lot of great research into looking into these particular outcomes. I think at the end of the day, if you do decide to take these medications, just be more informed. We're huge proponents of informed consent. So if you want to, if you think that taking these medications will help you reach your goal, that's totally fine. But just make sure that you're well aware of, potential side effects, the benefits as well, and that involves you talking to your family physician or whoever's prescribing these medications for you to make sure that you're doing it in a safe manner.
Yeah, and I imagine you wanted to get the word out as well because you speak to a good point. People should be talking to their physician, but in the age of the internet, that hasn't always been the case, right?
I think that that's one of the more concerning things is that you can get a lot of these medications online without like actually speaking to a physician. Just in the news recently as well, there's a huge crackdown on the fake Ozempic pens that people have been kind of selling on the black market. So it's very important to make sure that you get it prescribed by a licensed practitioner, whether that be your endocrinologist, family physician, whoever it may be, and then have a conversation with them and make sure that they explain to you how to use the medication properly, what potential side effects could be, and what to do about those side effects if they do happen. And then have them follow you while you're taking these medications on your weight loss journey, or for whatever reason you may be taking these.
Well, and it is so important to be informed. And I know when research like this is conducted and you find these results, often it can impact a ripple effect or change. So, warning labels, I know even there was an article this week, and the study in particular was done by Novo Nordisk, which does Wegovy. So, they were the ones paying for it. Which I just think is important to highlight, but theirs was talking about some of the cardiac benefits to their usage. But on the flip side, something like your research here that highlights very concerning issues if you are that 1%. So, what are your thoughts on the warning labels on these medications?
Kind of touches on some of the legalities and like the
Yep,
class action lawsuits and stuff. So I'll stay away from discussing that.
completely
But
fair.
but generally speaking, there's a lot of research coming out about these medications. Like the cardiorenal protective effects of these medications has been previously studied, and it does show that there can be a potential benefit in people with diabetes. Now, this new research is showing that it could be protective, somewhat protective in people using it for weight loss, which I mean is good. But like every medication in the world, like there's always benefits and drawbacks, right? Any medical intervention for that matter, right? If you're getting surgery, right, there's obviously risks and benefits of surgery, right? If you have appendicitis and you need to get your appendix taken out, there's risk of that surgery, but there's also the benefit, and that you get your appendix taken out and you're not going to be in a lot of pain, right? So I think it's important to kind of weigh those risks and benefits, and kind of the point of our study is to highlight the fact that people have different risk benefit calculations, right? So someone who has a hemoglobin A1C of 10%, someone who has very significant diabetes, they may be more willing to accept these potential adverse events than someone who, like you see in the news all the time, people who are using these medications, to lose that last 10 pounds or last 15 pounds, in preparation for a particular event or whatever. So people who want to lose that last little bit of weight, they may be, if they had informed consent, they may not be willing to accept that 1% risk of having a significant morbidity associated with this medication.
Well, and that risk versus reward benefit too is so individual, as you highlight, and again emphasizes the importance that you hear these results of weight loss. And obviously, I do a fitness and wellness podcast. And as much as the narrative is shifting in the fitness industry for the social benefits of exercise, the mental health benefits of exercise, and prevention of chronic disease, there is still that narrative of people that want the quick fix. And as this has gotten into a bit of a snowball effect, people are kind of seeking out this for the vanity drug purpose, which, again, no judgment if that's a life choice, but again, it's very important to understand the potential repercussions that could be involved in that. One of the things that it does tackle, though, is we are in a physical inactivity crisis, and as a result, our obesity numbers are quite high. So, just this is more curious on your opinion here. Do you feel, because we talk about a lot here, how I believe it's 84% of the population doesn't get enough physical activity? Do you think that people who maybe have been struggling and need to go from that no fit, inactive to low fit, that if they go this route, it could potentially help them along that journey since it gets the initial weight loss started?
As a healthcare professional, I'm going to resort to answering that question, from an evidence-based perspective, right? So, if someone wants to lose weight, great for them. That's awesome. There's, like you mentioned, there's so many mental health, physical health benefits of exercise, and doing exercise on a regular basis has shown to vastly improve health in all sorts of different perspectives, right? Now, if someone wants to, start taking some of these medications to help start that weight loss journey, that's a personal decision, and that's up to them, right? But at the end of the day, no matter what you're doing, making sure that you do engage in regular physical activity, whether that's strength training, cardio fitness, I don't know, swimming, like whatever you want to
So
do,
many
you do
options,
you,
which we're
right? Yeah,
spoiled
you
for
do you.
choice.
Yeah, you could if you want, you can go skiing, you can go swimming. I mean, we live in Vancouver, right? Like you can do that in the same day if you wanted to. I think at the end of the day, it's really important to make sure that you do engage in physical fitness. If you do choose to start, something like Ozempic, just make sure that you're informed about that decision, and then kind of go from there.
Yeah, and kind of on that note, because you did mention, and I know that it's one of the side effects as well, to the more research is coming out in regards to, I don't know if muscle waste or muscle loss. So would it maybe be more important to incorporate strength training if you are venturing on these? Because I would think that's something you need to combat. It's great if, let's say, you're using it for weight loss, that you're losing weight, but no one wants to be losing muscle as well because we need those.
Yeah, muscles are usually pretty important, right? They're what move our skeleton.
I have to carry my groceries up 3 flights of stairs every day, so they're very important.
Yeah, so I mean, I think research in that perspective is ongoing. Like I've read about what you mentioned, and it seems like there could potentially be an aspect of muscle wasting when people take these medications, especially long term. Um, but like I mentioned earlier, do whatever cardio fitness or weight training fitness, whatever you want to do, right? The benefits of weight training are very well known, like increasing bone density, increasing muscle mass. And when you increase your muscle mass, it increases your basal metabolic rate. And, even if you're sedentary all day compared to someone who doesn't have as much muscle mass as you, you'll end up burning more fat at rest, than someone who doesn't, right? Benefits of weight training are always great. If you're taking Ozempic at the same time, weight training is great. Like go for it. Do you.
I know it's often really hard, especially from the medical community, to ever dismiss the power of exercise. And
Yeah.
it's just like the more people we can get moving, the better. Lastly, obviously, one of the big topics of our conversation today has been the fact that if this is a route that you're going to go, that you should be as informed as possible. When people are going to their healthcare professional, are there certain questions that they should be asking?
I think generally, for someone who goes to their family physician or whoever that and tells them that, hey, I want to lose some weight, what do you recommend? I think I would be very surprised if there was a family physician who, at the first go, would say start medication. I think most people would generally say, try, if someone is otherwise sedentary, try engaging in physical activity. If they're not able to otherwise due to, another medical concern, maybe addressing that medical concern and making suggestions on how to work around that, or referring them to someone who can help them deal with that medical condition to help them moving. And then I think just, like we talked about before, just making sure that if you do decide to, start Ozempic or Wegovy or whatever, making sure that you ask about what are the potential risks. And more research is coming out. And on the flip side, asking what are the benefits, right? So obviously, you're hoping to lose weight, but like you mentioned earlier, there is some emerging research that there may be cardiorenal protective effects. Just making an informed choice, like if you want to start this on your weight loss journey, more power to you, right? But just be informed about, what you're getting yourself into.
I appreciate the research of you and your team that is helping people make more informed decisions as well. And we look forward to continuing to follow your work. And of course, there's research coming out around the globe on this topic. I have a feeling this is one that we're not going to hear quieting down anytime soon. But I just thank you so much for your time.
No, thank you for having me. I'm glad to be here.
You've just listened to the All Things Fitness and Wellness podcast, hosted by Chrissy Van. This episode was brought to you by Fitness World, your fitness, your way. Be sure to hit like and subscribe. We have new podcast episodes weekly featuring industry insiders and influencers. Together, we're on a mission for everyone to live a life fit and well.